my name is Amal Nirgadkar. I'm the CEO of Patient Prism. And in our studios today is JoAn Majors, who's talking to us about all things dentistry and optimizing dental practices and making team members really perform at their very best. And JoAn's been all over the country at conferences all over, and worked with group practices for over 20 years, right? And one of the big topics that I get our DSO clients asking us about is how do you reduce no-shows and cancellations?
Right.
And you've dealt with this issue and studied this for a very long time and successfully fixed it for many, many practices. So tell me what's your idea about this?
Well, glad you asked.
Okay.
One of the things I think, Amal, that happens is, and we were talking about this a little bit earlier, for me, that's a symptom of something that didn't get handled early on.
Sure.
I think that creating value and selling that block of time
Sure.
is the first piece that needs to happen. So if we don't, one of the things that will reduce it is having a strong transfer power and making sure that when we're scheduling that appointment, we say and create urgency for that appointment time. You
Sure.
know, I mean, that person who's making the appointment needs to sound as if there are 30 other people that want that exact time. Perception is reality. There are a lot of people who really want Sue to clean their teeth. And so if I give you this 4 o'clock with Sue
Right.
on a Thursday afternoon, I have to tell you that I have a lot of people that would like to have it. Let's make sure it works for your schedule.
Interesting.
I think that's important. Number one, I think that reiterating how important that is when you make that appointment versus just, oh, I'll go ahead, and I hear this a lot. I hear this in practices all the time, and it amazes me. Well, I'm going to go ahead and put you on the schedule here, and, well, I don't know my schedule or whatever. Well, I'll go ahead and put you here, and you'll get your first reminder, okay, because you're an adult and you need a reminder, 2 weeks out, and we can change it then if you want, which says we change them all the time.
So everything is optional.
That's exactly right, and
Okay.
I think that our language is so powerful. That's why, for me, the soft skills are the skills. You can take these, I think that in the next 3 to 4 years in dentistry, people will not choose a practice because of the technique. They will choose a practice because of the soft skills that are wrapped around that technique.
Absolutely.
That create value and urgency for the care. I think that, one of the things that we talk about with cancellations and no-shows is teaching and sharing with these team members to ask one question when they call. And it's only one question. And of all the things that I teach, I always say, listen to my thoughts and not my words, because I know that the last thing somebody needs is a lot of JoAns running around in their office. My husband would say that could be scary, but
Yeah.
I think that it's a question. Do you have an emergency? And you cannot, because people are uncomfortable with the question and they've never been asked, you cannot fill in the space. You
Sure.
must wait. And it's either yes or it's no, period. And I hear team members all the time. They say, well, I did that. And I say, okay, will you role play for me? Or with different services, as you
Sure.
know, we can record the calls and we go back and we use them for training, and you can
Right.
hear it. They say, do you have an emergency? There's that pause, and they're very uncomfortable, and they say, is everything okay? Did something happen? And it's like, now I've become your friend. Where when I say, do you have an emergency, I am the gatekeeper of my books, okay?
Sure, sure.
I'm protecting my schedule.
Sure.
The minute I say, is everything okay? Do you have a problem? I'm reaching out, and now I want to protect you.
Right.
So I think that it's understanding that it's just a question, and you ask and you wait.
Right. But at the same time, you kind of use the language to ensure that they understand that it's not, we're not sitting around at the office waiting for you guys.
Right.
We're busy and we want to deliver the best treatment possible, and we have other people waiting in line to get that same treatment.
Sure.
But so we're giving you, it's almost like, it's not like a privilege, but it almost is to be able to see your doctor
Sure
at
it
our
is.
office. It almost have to be in that
Sure
way.
it is.
Because that's
Yeah.
why we have these limited edition things, right? Because it's a privilege to have a limited edition car.
That's exactly right.
Or a privilege to have anything that has some scarcity involved.
That's
I don't
exactly
mean
right.
by scarcity mentality, but scarcity
No.
in terms of availability.
Availability.
It's not like, oh,
Sure.
we've got all the schedule open
Yeah.
for you.
Well, it's like saying we have a cancellation list. Yeah, I'll just put you on my cancellation list, which says we have so many.
Yeah.
It's like we don't say that. We will occasionally say, if it is emergency, and if they've done this now a couple of times,
Sure.
we'll say, I apologize. I've got to put you on a short call list, and what that means is basically, you've missed 2. I can't give you another 4 o'clock appointment because they're in such high demand.
Right.
But what I can do is I can put you on a short call list. And if should Sue have a change in her schedule, should doctor have a change in his schedule at 4 o'clock, we'll give you a call. At the same time, if you find that you're available, you're welcome to call us. So I don't want to make them mad, but at the same time, I've got to set some boundaries. And it's like anything else. We have to be willing to share that. And it's the same thing about, we don't like to say remind and confirm. We call and say, it's JoAn from Dr. Majors' office. Amal, I just want to let you know we're looking forward to seeing you tomorrow at 10 a.m. Do you have any questions for me today? That's it. Not call me back if you get this. Hey, let me know because I need to know, or we want to hear from you in 24. No, you made the appointment. We made an agreement, but you've got to enforce the agreement. I mean, I think that it's having the conversation.
It's a funny analogy I have with the steakhouse that we have in Tampa called the Burn Steakhouse. And it's really one of the premier steakhouses in the country. And absolutely you are following their schedule. They give you 10 o'clock, you better show up at 10 o'clock.
Yeah.
Because there's nothing else. There's no movement. There's no cancel.
We have no grace
show.
period.
There's nothing like that, right? And they control it so well.
Yeah.
Which means everybody follows their system.
Sure.
Either people would absolutely cancel if they're dying to go to Burn Steakhouse. That's how it is.
Yeah.
And I think it's so important to take control of everything you said earlier about the schedule. And when you take control of that schedule and make this into a customer benefit and tell them that this is important for them to come in.
It is the benefits. It is
all
they
about
really
the
don't
benefit.
want to know about your policies and procedures and your cancellation fee
fees
or
and all that stuff.
all those things. That's really not it. And even I'm not saying we're immune to it. We're definitely not. But you can tell when we have, transition even in our practice and you have new people and they haven't, watched all the videos or they don't understand the policies.
Sure.
You'll see one slip through and it's like, just try this. And I work with a small DSO down in Southeast Texas, and it's interesting because they started doing this, and what we found was when we do the role play and we would do the trainings at the seminars that I do there quarterly, the people who don't answer the phone, we had everybody role play it. The people that don't answer the phone were actually better at it than the people that answer the phone because we want people to like us.
Right.
So we're afraid if we say this or do this, then there'll be an issue. And then the second piece to that, which, I hope they'll stay tuned and come back and learn more, but the second piece to that is you've got to have a doctor who understands their role when the patient walks in, doesn't say anything to the girl at the front that had them come in, and you walk in and they say, well, I've never had a problem changing my appointment before, but that girl on the phone. So understanding, we actually had our doctors role play what their response would be, like, I'm sorry that upset you. I hate if you felt disrespected. They found their language to say, but she's just doing what we've asked her to do. We have a lot of people that want to be here. But it's like, it doesn't happen without setting up a system that can be measured and checked. That's what, and it's got to be everybody. It's like people that say, well, you don't understand what it cost us to shut down for 3 hours to do those trainings. It's like, let me tell you what it cost you. Just go back and add enough cancellations and no-shows.
Fantastic. Thank you so much.
Thank you.